Good evening and welcome to this special IHW Spotlight session on hepatitis and liver cancer on the occasion of World Hepatitis Day. I am Kamal Narayan, CEO of Integrated Health and Wellbeing Council, India's premier institution for health awareness, advocacy, and behavior change. Unlike the problem of heart or diabetes, which have captured the maximum mindshare of all of us thanks to the persistent advocacy by health experts and consumer product marketers, liver health has not got its due awareness. A healthy liver is as critical for life as your heart. And to protect the health of your liver, you need to be aware of hepatitis viruses and all of them, A, B, C, D, E, all types of hepatitis viruses that are present among us. You will understand why the world observes this day as Hepatitis Day when you will hear that hepatitis B and C viruses are one of the leading causes of death globally. And how does it kill us? These viruses cause chronic infection in the liver and put people at higher risk of cirrhosis and liver cancer. All that silently and stealthily, because most people living with this infection are not aware that they have the disease. India has about 4 crore people suffering from hepatitis B and another 1 crore from hepatitis C. These people and whom they can infect further are at a higher risk of liver cancer. Globally, hepatitis B and hepatitis C viruses cause 2 in every 3 liver cancer deaths. And in India, where liver cancers have become the fastest spreading form of cancer, experts attribute almost 90% of the cases to these viruses. But what is more important to note for all of us is that these are highly preventable and treatable causes. While we have the vaccine for hepatitis B with almost 100% efficacy, hepatitis C can be treated with drugs if diagnosed early. Accordingly, hepatitis has a clear priority in the global health agenda as Sustainable Development Goal SDG 3.3 mandates all countries to strengthen their hepatitis programs. And further to that, World Assembly Resolution aims to eliminate the disease by 2030, and India, being a signatory to the same, is moving towards its through the National Viral Hepatitis Control Program. We are actually the first country in the Southeast Asian region to develop such an action plan. And while this is a commendable achievement at the programmatic level, one gap seems to be silently and precariously thriving, and which is the increasing incidence of hepatitis-related cancer in our country. And as part of our collective Rapid Against Cancer, we at IHW Council believe that to prevent cancers, we need to look beyond cancers and address all those root causes leading to the fast-growing burden of cancer on our people. Through today's program, we endeavor to understand how, by preventing hepatitis, we can avoid liver cancers and how our healthcare providers and the system at large can work towards treating the liver to stop cancers. And to help us understand this, we are joined by some of the most renowned oncologists and experts and hepatology experts to reflect on the same over the next 2 sessions. So let me welcome our esteemed guest in this session, Professor Ravi Mehrotra, Adjunct Professor of Epidemiology at Rollins Institute of Public Health, Emory University, Atlanta. He also advises to the Center for Health Innovation and Policy, CHIP Foundation, and Data Cancer Genomics, DCG, on cutting-edge diagnostics of cancer. He has been the co-founder and he has been the founder and CEO of the ICMR India Cancer Research Consortium and has directed ICMR National Institute of Cancer Prevention and Research. Dr. Mehrotra has been a leading proponent of cancer control and affordable cancer care in India. So welcome Dr. Mehrotra to the program. And we are also joined by Dr. Anant Ramaswamy, Associate Professor in the Department of Medical Oncology at the Tata Memorial Hospital in Mumbai. And he treats gastrointestinal cancers with a special interest in hepatobiliary and gastric cancers, geriatric oncology, and supportive care. So welcome Dr. Ramaswamy to the program. We are also being joined by Dr. Suresh Babu, medical oncologist at Fortis Cancer Institute and associate professor at Kidwai Memorial Institute of Oncology, with extensive experience of around 16 years in the field of oncology. He has been working and has trained at some of the most reputed hospitals of our country. So welcome all our speakers to this panel. And interestingly, on this panel, we have mainly oncologists talking about hepatitis today. And that is what we want to achieve, where we can see that the treatment of diseases is not being done at silos and neither the prevention of them. So let me begin with Dr. Mehrotra. Dr. Mehrotra, we are trying to build a very different kind of discussion today. And, we are going to look at hepatitis control as, liver cancer prevention as well. So if we would like to begin with, to put the problem at the perspective, what is the magnitude of the problem at present, especially of cancer and in that liver cancer, and how much of it is attributed to hepatitis B and C viruses? Dr. Mehrotra, you are on mute, sorry.
Right, okay. I hope you can hear me now.
Yes.
Yeah. First of all, thank you for IHW Council and Kamalji and the team for bringing out this relatively important area, which has been hitherto, I think, ignored for various reasons. Today being the World Hepatitis Day, I think इससे बढ़िया कोई बहाना मिल नहीं सकता है इस बारे में बात करने का. So that is at the outset, I would like to thank the organization for bringing this out. The first question that you asked was at exactly what is the magnitude of the problem. As you yourself mentioned, there are far more cases of hepatitis B as compared to hepatitis C. However, the interesting thing is the majority of the people who have hepatitis do not know about it. So this is the biggest issue that we are facing. As far as the magnitude is concerned, 1.3 million deaths happened due to hepatitis in the world. And this is a number which you can compare it to tuberculosis. And of course, it is much higher than HIV or AIDS, which is always the most talked about, sexually transmitted infection. As far as hepatitis is concerned, as you well know, it is spread mainly by shared needles or by infected blood products or by infected injections. There is a link between drug use and hepatitis because quite often the drug addicts are sharing the needles, and that also causes the same problem. If you remember when a long time ago, the needles that you went to a doctor's office, they were being cleaned up and reused. Now that is no longer there. I think for the last 2 or 3 decades, the practice of reusing needles and boiling them or sterilizing them is over. Now, I think the vast majority of syringes, I would say nearly 100% of syringes are actually using disposable needles, thereby reducing the spread of hepatitis. However, India being a large country, there are all sorts of practices. Still, there is a good number of sharing of needles and also blood products. For example, you go to a blood bank, they would test it for hepatitis, but still occasional cases of blood transmitted or injection transmitted hepatitis does come across. So that is at the outset, I would like to give a broad overview of what is the extent of the problem. And also, I would like to talk about why it is important. Because if you do not know, obviously you cannot treat. And so the importance, as you possibly know, every child that is born, every pregnancy, they always do a hepatitis test and should be done. And nearly every private and government hospitals do have the facility of doing this test. So numbers are going down, but obviously in a country of 1.3 plus billion people, there are many people who are still getting infected and still who do not know about the extent of the problem. Over to you, Oncology.
Thank you so much, Dr. Mehrotra. And yes, you have kind of further highlighted the magnitude of the problem in terms of hepatitis and what are the causes which are leading to that. And definitely, despite a lot of safe health practices being followed now, I think at the healthcare system, there are certain definite, some gaps which are continuing to, I think, contribute to the increasing number of hepatitis as well. Let me look at the cancer point of view and kind of go to Dr. Suresh Babu. Dr. Babu, in terms of liver cancer, so we see that the cancer burden in our country is increasing, and we are seeing a substantial the projection in terms of the number of cases growing by year on year. And at the same time, I think the COVID-19 scenario has also contributed to it. Yeah. In case of liver cancer, what is the situation at present, and is it are we aware of the exact numbers of the liver cancer cases? Because if we put together the number of cases of hepatitis B and C, which is nearly 5 crore, and if we see the liver cancer cases are not kind of judiciously kind of reflecting the magnitude of problem, because as we see, if liver cancer is largely being contributed by hepatitis situation. So what is the scenario in terms of liver cancer in our country, and how it is kind of changing?
Yeah, I think Dr. Malhotra was telling that he just told what the incidence of hepatitis itself is not very clearly known, because many times it happens that in a oncology center, when you get a patient and you screen for something, ultimately you find hepatitis, patient will be absolutely asymptomatic. And the problem is that to develop a cancer for a hepatitis patient, it will take a lot of years to come. So that's why the actual burden of the hepatitis itself is not known. So to know the real burden of the hepatocellular carcinoma would be very, very difficult. Another aspect is that the hepatocellular carcinoma in hepatitis patient will develop. It will take years to develop. So probably sometimes even up to decades. So to really assess the burden of the disease, again, a major challenge. One more challenge with the hepatocellular carcinoma with hepatitis is that most of the patients do present with very advanced stage, especially patient would have had underlying cirrhosis and all those things. So these are some of the problems with hepatocellular carcinoma. And the third point is, as the hepatocellular carcinoma is one of the tumor which is not so sensitive to chemotherapy, that makes the tumor to treat much more difficult. That's why though if you compare the cancers with other cancers to the hepatocellular carcinoma is one of the difficult cancers to treat. And it is also contributing to the mortality for all the reasons, because we don't know what is the exact incidence of the hepatitis existing in the society. So number two is that they are taking many years for develop to hepatocellular carcinoma. Number three is that most of the patients do present with advanced stage of hepatocellular carcinoma. Number four is that we don't have such an effective treatment. We have some treatments, but they are coming with a very costly affair like immunotherapy and all those things. So these are some of the disadvantage. Probably the hepatocellular carcinoma is not dealt in a way as it used to be. These are all some of the hurdles in a country like India where to treat hepatocellular carcinoma.
So you are saying that liver cancers are, I think, much more difficult for treating, and reason which you have listed is that delayed diagnosis is one thing, so they are coming at advanced stage, but at the same time the limitations for chemotherapy also in the treating that is one reason. What is the estimated death rate when it comes to liver cancer? Because there are some cancers which we consider are easily treatable, and there are larger hope for that. And I think if we are able to convey to the people that what is the chances of liver cancer survival, then I think we can also drive the whole point of that why it is important to prevent them and also prevent hepatitis.
So one of the, as you rightly told, one of the very important things in hepatocellular carcinoma is that in what stage we diagnose hepatocellular carcinoma. So if we diagnose a hepatocellular carcinoma in a very early stage with a very good liver not being cirrhotic and in a healthy liver, you can almost cure the hepatocellular carcinoma. The other argument is that if you diagnose a hepatocellular carcinoma in a very early stage, the treatment available, at least antiviral drug, whatever nucleotide inhibitors, what we are available today, with that we can delay the development of hepatocellular carcinoma. So in an early stage hepatocellular carcinoma, there are many modalities of treatment, including the surgery, the invasive procedures where we can completely cure hepatocellular carcinoma. But if a patient presents with advanced stage, then the treatment option completely becomes palliative, like just looking for the improving the overall survival rather than looking at the cure rate. So that's where the awareness about hepatitis and all those things comes to matter, that even if you have hepatitis, it's better you seek the doctor advice as early as possible before developing the liver damage and cirrhosis, so that the cure rate or further development of hepatocellular carcinoma can be prevented. So that's where where we seek the doctor in the hepatitis matters very much.
Thank you so much, Dr. Babu. So, Dr. Ramaswamy, as Dr. Babu is saying that early and timely diagnosis holds the key for controlling. Actually, it is same for both hepatitis and hepatocellular carcinoma, or which we can say liver cancers. How do you see the same being facilitated in our health system? Who at which level shall make it happen? And what is the role can be played by different specialists, or maybe at a level of preventive checkups and screenings?
So we are a country where hepatitis B is rampant. There's very high rates of hepatitis B. So we are actually in a position where a screening program would actually help, a screening and surveillance. It's still not part of the governmental programs, but because of its high incidence, it's something that could be done. But when it's not been done, the next step is that once you have been diagnosed with hepatitis B or hepatitis C, the key thing there is that you should be aware that cirrhosis and cancer can develop at later points in time. So even if you're cured from the hepatitis B or hepatitis C, and hepatitis C is now imminently, curable in terms of an infection, then you need to be on follow-up with that particular doctor. You don't have to go to a specialist at that level. You just need to be under constant follow-up, and you need a certain degree of vigilance with whatever level of medical care that you are under. And that should take care of the problem in the absence of screening and surveillance, which is government promoted. I think that is the key. Otherwise, as I think Dr. Babu and have clearly said, the problem with HCC is fourfold in India. You have, advanced stage of presentation, you have an underground cirrhosis, you have undiagnosed infection. So, those problems are then, almost insurmountable because of the late stage of presentation. So that's what I think should be done.
Yeah. So, Dr. Mehrotra, both hepatitis control and elimination is a government priority. We have seen that the program is there. Though Dr. Ramaswamy is saying that there's something like screening is still not being conducted into that level. Do we really see these two things, together when it comes to health system response, both hepatitis and cancer? Because both have to be the high priority, what we believe. and if yes, they look at both together, how the same can be made more in terms of health system response towards controlling both these diseases. Screening is important. As we have been saying that many of and Dr. Ramaswamy is saying that hepatitis B is rampant, and problem is that most of us don't know about it when they have it, and it may delay the process. So how do you see the healthcare system playing a role into that, and how these two things can interact better in terms of achieving this outcome?
No, I think that's a very pertinent point brought out by both Dr. Suresh and Dr. Anant. To give you some very rough figures as far as hepatitis is concerned, I mentioned the total number, but when you look at the world overall, every 12th person in the world, that is 1 out of 12 across the world, is infected with hepatitis. And liver disease is the 12th leading cause of death. So if you remember the figure 12, that fits into hepatitis and cancer very well. And the tragedy is that nearly both these, not nearly, but practically all the hepatitis is entirely preventable. There is a vaccine. If you remember, it was released way back about 20 years or 30 years ago in the 1990s. Each dose was 500 rupees or so. It was not, or maybe more actually. I remember paying nearly 1,000 rupees for every dose. And now it is hardly 50 rupees, maybe not even that, and it is delivered free as part of the government plan. So that is the first thing, how this whole hepatitis story is concerned. And now with the COVID infection and the pandemic that we are facing, people are more and more talking about vaccines. So there is no reason why every mother and every child should not be vaccinated against hepatitis B at least. Unfortunately, so far there are efforts to make the vaccine for hepatitis C, but so far it is not. So that is actually, I was wanted to give the background as what is the numbers. All over the world, it is 1 out of 12, not only affected, and also it is the 12th leading cause of cancer. So when we talk about the health systems, as you well know, about 2016, the Honorable Health Minister released the national program. I mean, it was already there, but it was subsumed the National Cancer Program. Just before that, it was subsumed in the program for chronic disease detection, that is combined with diabetes, hypertension, stroke, and of course, cancer. So obviously, we have many kinds of cancer, but the most common cancer in our country was breast, cervix, as well as the oral cavity. So those were practically forming more than half or nearly half of all cancers. So that the effort of the national program was focused on these three. Since liver cancer, of course, is very important, but it does not, fortunately, I would say, does not form the top 10 cancers. So it was not given the same importance. But at the same time, in 2018, there was a national viral hepatitis control program was started on the World Hepatitis Day, that is today, that is July 28th, so just about 4 years ago, 2018, right? So it is an integrated approach for prevention and control of viral hepatitis with the view to provide free of charge screening, diagnosis, treatment, and counseling. Now, it all sounds very good, but we all know it is easier said than done. So at the present moment, it is not, the screening for viral hepatitis is still not part of the uniform screening for diseases. As I mentioned, if whenever you go to give a blood transfusion, for example, you are donating blood, if you are going for a hospital for any operation or any invasive procedure, they will check you. Just now, for example, we are testing for COVID. As a routine, people are testing for HIV and hepatitis B at least. So what has happened is as part of the screening, or people especially belonging to the high risk group, as I mentioned, the pregnant woman, anybody going for an operation who's severely ill, these to achieve the WHO SDG goals 3.3, which you mentioned, this was aimed to end viral hepatitis by 2030, which is just about 9 years to go. It is ambitious. I hope and pray it happens, but at least we are on the way. So now viral hepatitis is recognized as a major health challenge. It caused, as I mentioned, 1.3 million deaths in 2015, which is of course the number which is comparable to deaths caused by tuberculosis. It's again a very major problem. Nearly all, India still has one of the largest number of deaths due to tuberculosis. And nearly all of these deaths due to tuberculosis are preventable, as is hepatitis B. The exact burden is not known. However, the literature available indicates a wide range that hepatitis A is responsible for nearly 10 to 30% of acute hepatitis and 5 to 15% of acute liver failure. Right now, as I mentioned, when there is so much emphasis on COVID, people are aware, people are amenable to taking vaccine, at least majority of the people are. There is no reason why anybody should be bereft of the vaccine. Coming back to your original question, at the moment they are working at two separate programs, the National Viral Hepatitis Program and the National Cancer Control Program. There is definitely a need that both these programs should be interlinked with each other, thus by reducing the morbidity and mortality caused by hepatitis B and C. As you know, especially in chronic hepatitis, there is a chance of leading to cirrhosis. Just as an aside, the other common cause of cirrhosis is alcohol. Although it is a serious problem, but obviously nowhere near what is it in the West. But we have other problems in India, which is even non-alcoholic cirrhosis with there. But as far as hepatitis cirrhosis is concerned, nearly all or most of the cases of hepatocellular carcinoma or liver carcinoma are related to cirrhosis. It is found all over the country, but far more are found in the northeast of the country, which, as you know, I'm sure you remember, we have talked about this before, the northeast of the country, those 8 states are actually the hotbed of cancer. If you look at the National Cancer Registry Program, you will find that maximum amount of cancers will be in those particular states, and they have now a reasonably well-working cancer registry program. That is how we found out, and that is organized by the ICMR. And these cancer registry programs have surprisingly showed the number of hepatitis is very high there. So it is also hepatitis B and C. At the same time, you also find that the drug abuse is also maximum in that area, and now of course increasingly so in Punjab and various other states. So that is one of the major reasons how you are finding that hepatocellular carcinoma and liver cancer is increasing in number. Unfortunately, as mentioned by our oncology experts here on the panel, Dr. Suresh and Dr. Anant, you find that most of the people are presenting so late that it is next to impossible to treat. If they present early due to some other reason, they are operated and you find a cancer, or they are lucky to go for an investigation for an unrelated problem, it is definitely amenable to treatment, though expensive. I hope I can give you a broad idea of where is the government health system, where are the private health systems, how they are interacting with each other, and what is the way forward.
Yeah, so the way forward is that interlinking of both the program, which are working at I think different level and separately for now, but I think there is enough interaction happening at the disease level between the two areas, and I think the programs also need to reflect the same. Dr. Babu, so I was mentioning about COVID-19 and Dr. Mehrotra has also touched upon that. If we see overall and if we look into the how COVID-19 has impacted the overall health system support for the people or disruption of services, we have definitely seen some kind of delay taking additional toll on almost every disease, be it cardiovascular diseases or stroke or even diabetes. So care somehow has got disrupted at all level, and almost I think 90% of the countries, and especially the lower and middle income groups, are still experiencing that kind of disruption. what you have seen in terms of chronic liver disease management is the same kind of situation, and if it has happened, how it is going to change the liver cancer scenario in the post-pandemic world, though we are not out of pandemic yet. But are you seeing some upward kind of movement in terms of number of liver cancer cases being diagnosed or reported?
The thing is that it is more than liver cancers being reported. The problem is that diagnosed liver cancers are not able to come for regular follow-up because of the corona and all those things. Possible that the liver cancers are being reported more because most of the cases, most patients, India being a major population, being in rural area, they may just neglect until they become really symptomatic and they may sit at home. That could be the reason. The other thing is that in a COVID era, even the primary healthcare system have been more concerned about COVID than other problems. That has happened in a very big tertiary care centers, like very big hospitals. That can happen in PHC level also. So primary health cancer centers also, they are more concerned about the corona rather than other diseases. What as the regional cancer centers or whatever we done in Kidwai was that we tried to revamp our telemedicine department very particularly. We shared all the consultants, the phone number to try to communicate with all PHCs. It is happened basically because of the government of Karnataka. Every consultant was given a particular day and particular slot, and patient was asked to consult through the telemedicine through a primary health care center. We tried to manage, but it may give some success, but it's a very difficult for a rural population and also. But overall, we must learn how to use all those systems because COVID is an extraordinary situation. You may face with this situation in the future also, or it may go. But only thing is that we must see that how we are going to follow up. We must, if some primary healthcare physician is ready to communicate with you for any acute problem of any patient, then you must be ready to help them. So like that, we have tried to manage the patient. One of the good thing or advantage for the hepatocellular carcinoma is most patients are in tablets. So unlike, where other injections, other drugs where you may have to give chemotherapy and all, most hepatocellular carcinoma or hepatitis, you have a oral tablets, which can be monitored through a telemedicine center or over the phone when they are in follow-up with the local physician, which is the advantage. When a patient becomes in a very advanced stage of the hepatocellular carcinoma, we really don't have much drugs to treat them other than giving them symptomatic treatment. So whether it's a hepatitis or a early stage of the hepatocellular carcinoma where they can manage with the tablets, and this can be managed with the help of telemedicine or communication with the local physician, which I think is a little bit advantage for hepatocellular carcinoma.
Thank you, Dr. Babu. Dr. Anant Ramaswamy, you are at Tata Memorial Hospital, which is, kind of, I think, getting the largest number of patients. Do you see some kind of change on the liver cancer number of cases of late, which might have been a result of delay in, let's say, on the treatment of disruption in the treatment of hepatitis, or maybe delay in the diagnosis itself?
So we don't have data on this from Tata, but we do have data that there has been a marked delay in terms of stage presentation for all cancers. So we don't have liver specific data, but almost all patients in terms of, let's say, between November 19 to March 20, you had gastric cancers and HCC presenting more in stage 3. Now, for example, and now the patients that are coming to us because of delays in treatment and logistic issues, more of them are presenting in an advanced stage. But specifically for HCC, we don't have any data that there is an increasing incidence or that. But across tumors, yes, they have presented at a later stage because of, the focus on COVID and the fact that people are so worried about COVID, they're not coming forward for cancer-directed therapy, which is probably the worst thing to do, because COVID is there, but a number of these patients, if they were treated well and on time, they, could have been potentially cured, operated. Now that's not happened, and they're all coming to us in much later stages.
Yeah, thank you so much. Dr. Mehrotra, actually, I want to ask a little, again, policy-oriented question, but before that, I want to understand, you have also, kind of mentioned, and I think what Dr. Ramaswamy is saying is also that we don't have a liver-oriented specific data, and this is where I want to, again, look at from a very layman point of view, because again, if we see, as I began my whole program, that we have more focus on heart, we have more less focus on brain. So heart attack is much more, known, and, a lot of work and a lot of awareness is there, but not for stroke. Similarly, among the cancer, as you said, and Dr. Suresh Babu also said that this is one of the more difficult cancer to treat. And keeping in mind that the overall other attributes of lifestyle and other things, there apparently seems to be that India should be having more liver cancer cases, and that is where we are seeing it increasing also. And you have seen that hepatitis is one important contributor, but at the same time, the lifestyle problems such as, let's say, the alcohol is another contribution, and the third can be even non-alcoholic liver diseases which are maybe coming out or happening because of the lifestyle issue. In all this scenario, and keeping in mind that liver also need to be given a due, I think, importance. What do you see that these numbers should be? Should there be a more specific approach towards that there is a possibility with the space liver cancer cases are growing, it can take over and it can become maybe the second largest cancer in our country over the period, the way the lifestyle is changing, and if something like hepatitis continue to exist without effective elimination.
No, thank you, Kamalji. What you are saying is correct in the sense number are going up, but nowhere near the rise in other cancers. So I at least cannot see in the next 10 to 20 years that liver cancer will become the number 2 cancer. Because right now, if you look at the data from the Globocan, which is a WHO facility, as well as the National Center for Disease Informatics, our own Indian Cancer Registry program, number 1 cancer in the country is in the female, that is the breast cancer, which is followed by head and neck cancers, as well as cervical cancer is actually now number 3 in the list. It used to be number 1 earlier, but now with the changes in cervical cancer diagnosis, and the numbers are actually, the one cancer where the numbers are going down, although very, very slow, just by about 1 to 2% per year. But over the many years, if you look at the cancer registry from, say, Bombay, you look at Delhi, Bangalore, all the cervical cancer is going down. And as I mentioned, liver cancer is number 12. Maybe it will come to number 11 and maybe over 10 in the next many years. But I don't think, even with the very correct monitoring and evaluation which is done by the government and by nearly every major cancer hospital, whether it is Kidwai, or it is Apollo, or it is Rollins Institute, or Tata, everybody, all of them have a reasonably robust cancer registry program. So I don't think that is, I don't want to be a scaremonger. But at the same time, any cancer which is preventable, which is not being prevented, to me, as a preventive oncologist, it sounds a big dilemma. I mean, I would love to have our friends, Dr. Suresh and Dr. Anant, out of a job if the number of cancers really fell down dramatically. And I'm sure they won't mind. But the reality is certain cancers cannot be prevented. You talked about brain cancer. Again, like liver cancer, it is a relatively small number. But for that individual who gets the glioblastoma multiforme or any serious brain tumor is a very bad road, because they are diagnosed late, the treatment opportunities are very, very few. But fortunately, diseases like gallbladder cancer, again, India happens to be one of the major capitals of gallbladder cancer. And again, I will not like to digress, but they are mainly found around the Indo-Gangetic belt. If you go to Kerala or go to Maharashtra, you won't find any gallbladder cancers there. Liver cancer again, mainly in the northeast. Pancreatic cancer, very few cases. But if they are found, it is really like a death sentence. So I don't think that is going to be the issue. But for the point of view of prevention, I would like to talk about 3 or 4 things. Number one, I would talk, like today's program is very important. I wish more people were attending on your Facebook and various other social channels. Awareness generation. How you can change behavior, which you can reduce the number of cancers. How do you immunize hepatitis B at birth, high-risk groups, and especially healthcare workers? There should be no healthcare worker who has not received the hepatitis B vaccine. Safety of blood and blood products. Injection practices, not 100% make sure you don't reuse needles. So in Northeast and Punjab and various other high-risk areas of the country, there are 3 needles that are available. And they should be more freely available than what they are right now. Again, to prevent hepatitis A, which of course not related to cancer, hepatitis A, E, and so on. Talk about safe drinking water, hygiene, and sanitation in the toilets. All these things are important. And food safety, of course. Then we talk about early diagnosis and treatment. We just talked about it. Nearly all the institutional deliveries, now practically 80% and more kids are being born in institutions, and hopefully that number will increase. And all are getting not only the test, but also a birth dose of hepatitis B vaccine. Screening, diagnosis, and treatment of both B and C. Provision of linkages with various private as well as for-profit, not-for-profit institutions. And engagement with communities and peers. All these things are important. And I personally feel, provided these things are taken in place seriously and with better involvement, see, everything the government cannot do. It has to be done by the individual, has to be done by the private sector. And ideally, working hand in hand, that personally speaking is the way to go. Blaming everything on the government just does not work out. So awareness at the grassroots level about hepatitis kya hota hai? How does it spread? What can you do? Even this is extremely important. And that is the reason why at the outset I started that you have picked up on a very important area. And if we do talk about in even your programs in various social media, and you know that social media, how important it is to spread information. Unfortunately, it spreads misinformation also. But as far as information is concerned, this is the right time. Making sure we have increased capacity development and training of medical and paramedical workers. All these things are important. And I see no reason why we should not be able to at least decrease, forget the increase, we should be able to decrease the number of unnecessary deaths by this particular cancer.
Yeah, thank you so much, Dr. Mehrotra. And it's good to hear that liver cancers are, growing, but there is no, possibilities of them becoming a major contributor in that sense. But at the same time, as you mentioned, that anything which is preventable, and if we are losing lives to a preventable cause of preventable cancer, that is something which we all need to work on. At the same time, you have mentioned about that. Multiple aspects are important, right from availability of clean water to safety of blood products and transfusion, and at the same time the the institutional deliveries which are happening, which is also kind of helping us prevent through timely vaccination as well. I think the government of India is also taking if you see multiple programs going on, they definitely help contributing in multiple aspects. And even if the hepatitis elimination, if also we see, it's quite multidimensional, from immunization to Swachh Bharat to safety of blood products and safe drinking water, all that. And I think that all is critical in terms of reaching towards the elimination of not only hepatitis virus, but many other diseases as well, which are caused because of the preventive causes. But at the same time, if we look into the both cancer and hepatitis as a areas, how do you see that at the service, healthcare delivery level? these multiple things can converge in terms of preventive, diagnostics, and treatment, and also the monitoring tools can play a role. And if, as you said, that those things cannot be put on the government, but at the same time we need to have a better health system which is helping achieve these objectives. So how do you see that they can come into a multi-sectoral kind of convergence and help controlling both the diseases?
Well, I think you have already given the answer to your question. For better communication. See, you are a person in this IHW Council is the communication and a knowledge channel, isn't it? So better communication between the various branches of the, not only government, but also within the health workers. For example, we have medical oncologists here. In the next session, I know you're going to have hepatologists and gastroenterologists, them talking to each other, number one. Number two, there are setups, for example, the National Center for Disease Control, NCDC, which is here in Delhi. It started playing a more active role. That is supposed to be the Indian CDC, or the Center for Disease Control and Prevention in the US. You have specialized center, for example, although focused only in the major metros like the ILBS, which is the Institute for Liver and Biliary Sciences. And also you have tertiary care setups, not only in oncology, but also in gastroenterology. And everywhere you are finding the National Viral Hepatitis Control Program, the NVHSCP, is the cross-cutting area. But they don't talk to each other as much as they should. I have absolutely no problem in accepting that this is one area, just like give an example which is unrelated, talking about the armed forces. There used to be a chief of the Army, Navy, and the Air Force. Now, there is a control for one person is there, the CDC, who is actually as an advisor who's combining all the three forces. Similarly, now with public health getting more importance, I think way to happen is that now there is also a move from the government to have a public health cadre of people who will only be looking at public health and who will be like a resource whenever not only we have a crisis like COVID, but also in the routine care where, for example, things like tuberculosis, HIV, and I think hepatitis should also be one part of it, where they can link all the different dots and make sure, as far as oncology is concerned, as far as hepatitis is concerned, as far as tuberculosis or HIV, because quite often they are common factors. For example, needles sharing, which I mentioned, repurposing and reuse of needles, is the common cause for spreading both HIV and viral hepatitis. You are finding that safe blood, that also causes not only hepatitis, but also causes HIV. It also causes various other disease spread. So when you have the STD program, that is the sexually transmitted disease, there also you have HIV, and then you have syphilis, gonorrhea, and the rest of this thing. So I think the cross-cutting venture which you are talking about is extremely important, and we talk about monitoring, evaluation, surveillance, and research. I am a researcher, I am a physician. I will definitely like to give a plug for research which is appropriate for the country, which is translatable, and also which can make a difference in the common man's life as we go along in this particular fight that we have started.
Thank you so much. I think we need to look into those cross-cutting areas and make efforts.
I just want to add what Sir was telling. See, one of the things is that, the integration of a oncologist, hepatitis, hepatologist, whatever is there, it will happen in a regional cancer center or a tertiary care centers where we work. There are a lot of specialists. At least, for the tumor board purpose, we never hesitate to take a gastro or hepatologist opinion. One of the very important thing what Dr. Mehrotra was trying to stress was the prevention, which is a preventable disease. Unnecessarily, there are many cancers which we can't do much about it, but there is a cancer which you can do much more about it. To overcome this, one of the very important thing is that over the years, we have tried to strengthen our primary healthcare system, which is very, very important. Like, for example, in a rural sector, in a PHC, there is one doctor. He has been burdened with hundreds of health, schemes. Like For example, he has to take care of maternal health. He has to take care of the heart, cardiac health. So that the primary healthcare system need to be strengthened. If you see in a regional cancer center like Kidwai, where we see more cases with hepatitis positivity, or more of them are a rural background. They will not be aware what is happening. When they come here, when we do screen, we will come to know. So government has taken a lot of steps to counter. You are only mentioning Swachh Bharat, clean drinking water. So all those things over the years should help, but we must also look at this, how to strengthen our peripheral healthcare system. Once that is strengthened, it's not only the hepatocellular carcinoma, most of the disease will be taken care.
Yeah. So thank you so much, Dr. Babu, for highlighting. And then again, I think it comes back to the strengthening of the primary health care. And I think that is a solution for a lot of problems which we face as a country. But at the same time, that solution is elusive for quite some time. And, I think together with the new focus, and I think the COVID-19, jolt in that sense, may help us move towards that in a more rapid pace. Dr. Anant Ramaswamy, let us go towards the individual behavior and responsibility towards preventing, these diseases. What is your, take on how, as an individual, we can kind of prevent hepatitis, at the same time also prevent liver diseases and cancer, and also other type of cancer? What are the points which you would like to share for our audience? And also Tata being let's say a major center for cancer care, with so much of footfall happening over there and people coming with cancer patients, I think that is also a good window to not only educate one person about cancer prevention, but at least the whole family also, and many of the causes which actually lead to the incidences of cancer. Do you see that at an institutional level, those kind of practices are followed, and we take that opportunity of educating, the families and the people, towards the prevention as well, while they are undergoing, or one of them is going for treatment, how we can make many other, kind of aware for prevention?
So I'll take the first part. The WHO has a series of recommendations, 6 to 8 recommendations, I think, on healthy living. I think it's very simple stuff like, not to take more than this amount of alcohol, not to smoke, this amount of vegetables, fruits. These are very basic things, right? But they contribute if you continue on that path, there are a number of problems, not just cancer, right, that are taken care of. All you have to do is just that. I mean, they have limits for red meat, alcohol, no smoking, this much should be your quantity of fruits and vegetables. That takes care of so many problems. So at an institution level, we are already way beyond that. A person has actually come to us with cancer and we are not in a position for that particular person. That said, the moment they enter our minds, we can talk to the rest of the family about these particular aspects. And that, for example, I mean, we still have patients who are on treatment for oral cancers and still chewing tobacco. It happens. So, once a patient has been diagnosed, that is the best time to systematize and, tell the family around them, this is what happens when these habits are followed. So at an institutional level, I think that is the one thing that we can do. Beyond that, we conduct a lot of CMEs. There are a lot of programs for patient attendance on how to deal with patients who have cancer, and that is another time that we use to educate them. But by the time we come to an institution level, we've already missed the boat. That's what I feel. This is something that should probably start from school or something. It's not something that can be done at an institution level. And I think, as Dr. Mehrotra said, this does not require the government. It has to be started from a familial level and from a school level. Things about cleanliness, for example, slightly unrelated, Japanese children are taught to clean their own classrooms. In India, we could use the same thing, no? inculcate in our children at that level that cleanliness, clean water, all that is important, and then take it from there. By the time, and I think Dr. Babu had also mentioned this, from the time an infection has happened to cancer is already 15 to 20 years. You missed the boat. From a societal and country level, it has to start from that level. At an institution level, it's much later, and you're essentially just trying to recover what is left. I mean, these are changes that have to happen much earlier. At an institution level, you can educate, but then the deed's been done. So that's what I feel.
Thank you so much, Dr. Ramaswamy. Important point, actually. I think though we need to catch the boat on time and maybe catch them young, as you said. It should start in school. I think Dr. Ravi Mehrotra has also been the advocate of it, and I have been hearing him about this point for some time. But yeah, so that is one area for sure. But at the same time, when you have missed the boat, at least you try to salvage something, as you said, at the institutional level also. Dr. Suresh Babu, what do you see, and how do you see that on this Hepatitis Day? What would be your message for the people for maintaining healthy liver? Though you are an oncologist, but they come to you with a diseased liver. So what is your take for them to kind of help preventing hepatitis, keep liver healthy, and also preventing cancer too?
I think most of us, it's just a general health practice, as Dr. Anant was referring to. One of the things is that if you are not vaccinated, get vaccinated for hepatitis B. That is very, very important. Number 2 is that practice very highly healthy hygiene practices. Number 3, avoid alcohol. There is a limitation for everything. Smoking also contributes for the development of the liver cancer. So age is one factor, and the sex, male being one factor, which you can't change that. At least you can avoid alcohol, smoking. Good food habits may give you prevention from that as the aflatoxins, which you may worsen the liver damage. So take the vaccine, and whenever you go to any doctor, sometimes it happens that in a rural setup, or when you go to somebody who is doing healthy practice, which may not be qualified doctor, which they are trying to use same needle or anything, insist for using the particular disposable needles. All those things can help you prevent. This can happen only, as Anant was telling, to inoculate from the school level. See, as a student, when you grow up, you know that the using same needle for other people may cause you infections. Then you would definitely not go for it. It's like that good food habit, good, drinking water, avoidance of alcohol, smoking. These are very simple things. A vaccine is a much, much later option. So when you go for these options, I think you can avoid most of the liver damage and other cancers as well. Vaccination is one more added factor which you can do that. This is the basic things which everybody can follow and keep their liver very much healthy.
Thank you so much, Dr. Babu. Important point, and I think it squares back to the healthy lifestyle. Dr. Ravi Mehrotra, what is your take on it? And as a preventive cancer expert, what do you say, and what learnings from COVID-19 behavioral change, which we have seen, transformation in behavior, can it translate into prevention and control of many diseases which we have been talking about for some time?
Well, let me take your last part of the question first. COVID has hopefully not only opened our eyes, and the government's eyes also. I mean, we are, I don't think I need to repeat, we were at the lowest health spend in any developing country of its size. Even Bangladesh was spending about 3 times what we are spending. So hopefully, the health spend will actually go up at least 2, maybe 3 times. That is what the government is offering at the moment. I hope they do this in the next, not only next 5 years, but in the next year, as a matter of fact. Any government which does not look after the education and the health of the country is bound to fail as a country. So that is an old dictum. Education and health are the pegs. So let's talk about health now. The government will do its part when it does. And as a matter of fact, I would like to go one step further from the school. We talked about healthy habits, we talked about cleaning of schools, we talked about all the motivational factors, the lifestyle factors. What is even more important is the home. Because after all, the foundation, that starts always on the home. So if the parents are aware, the children automatically get aware. Why it is that, we should be throwing our cooler in the next door, in front of the next door person rather than cleaning it up ourselves. So gradually, all these things are going to be important. Starting from cleanliness, you already talked about tobacco being the single most preventable cause of cancer. Alcohol, here again, it is very important, no doubt about it. Simple thing, not connected to hepatitis, but areca nut, supari, is a known carcinogen without any argument. Group 1 carcinogen as far as IR is concerned. I would be very surprised if more than 5 to 10% of the population, including our medical professionals, know that supari is a known carcinogen. So, as they say, charity starts at home. So, training, capacity development of our medical workers, paramedical workers, and at the same time, the point that you talked about of catching them young. As you have seen, it is the cricketing season, it is the Olympic season right now. It is mainly the youngsters who are creating these waves and who are changing. Similarly, as far as awareness is concerned, whether it is hepatitis awareness, it is healthy lifestyle awareness, or it is cancer awareness, start as soon as possible. I would say they should be taught not only in the home, start from KG, start right as soon as the school starts, starting from awareness. And these issues, along with vaccination, along with regular checkups with the medical professional every year, in the army, as you well know, these and also in the corporate where insurance is looking after it, is compulsory to go for a medical checkup every year. Otherwise, your promotion is stopped. If we buy a new car, you buy a two-wheeler, you go for a service checkup without any fail, at least the first year, maybe it's 2 years. If you can look after your vehicle, how about looking after oneself? I think that's a no-brainer. And if one looks after oneself, gets the regular checkups, at least the preventable cancers, changing lifestyles, you will find that over the years, maybe not by 2030, ideally yes, but maybe not by 2030, but by 2040, you will see a marked decrease if we keep on doing what we are talking about. On that positive note, thank you once again.
Thank you so much, Dr. Mehrotra and Dr. Anant Ramaswamy, Dr. Suresh Babu, for your sharing now knowledge, and also you have highlighted that how hepatitis B and C is contributing to the burden of liver cancer. And the important aspect is there's a completely preventable disease burden which we are facing. We can definitely prevent it by preventing the hepatitis itself. So the next session is going to be hosted by my colleague, Dr. Nalini Kaushik, and we have some leading hepatologists and gastroenterologists on the panel, which is coming up. And they are going to talk about that how we can actually, help preventing hepatitis, and not only preventing hepatitis, but also keeping your another very important organ healthy, that is liver. So take care of your liver as well on this hepatitis day. This is the message, and by doing that, we can definitely, kind of reduce the burden of many diseases and even death. So thank you so much for joining. Over to you, Nalini.
Thank you.
Thank you so much, Kamal, and thank you to all the panelists. I think this was in fact a very insightful discussion, and the two key points that all the experts mentioned about, one is the multi-sectoral convergence, because the kind of problems that systems are facing, in today's time, I think they cannot be resolved without a multi-sectoral convergence. And I think the last message, which was echoed by all the speakers about the institutional and socio-cultural, the basic practices, I think it aligns very well with the larger ideology of that IHW Council itself is working towards, which is, essentially, the practices which would move you or take you towards, not just good health, but the well-being. So thank you to all the panelists. And so moving forward, we are starting our next panel, which is on the topic access to treatment from commitment to action. So, as we observe World Hepatitis Day today, now it is very pertinent to highlight that this day is officially mandated as one of the global public health days by the World Health Organizations. And due to the massive incidence globally hepatitis, even the World Health or even the Sustainable Development Goals included viral hepatitis elimination as one of the priority areas. Now, despite such global recognition and even in the national recognition at the national policy level, hepatitis related mortality is high. And in fact, it is said that hepatitis claims a life every 30 seconds, and is also one of the most deadliest and the neglected diseases. However, at the same time, what we have seen unfolding in last 10 years or so is that on the treatment level and also at the preventive options level, a lot of affordable treatment options are coming up, and sometimes in form of some treatment medicines and also vaccinations as well. Against hepatitis, and if these are adopted very consciously and at the right time, we can in fact prevent hepatitis related death, hepatocarcinoma, and in fact the overall burden of which are faced by the health systems. However, despite these developments, we are still grappling with some of the very basic health system challenges. So today at IHW Council, we take the opportunity to do our share of awareness on hepatitis, and in this we are joined by some of the very esteemed speakers in the area of hepatology and gastroenterology. So we have with us Dr. Neelam Mohan, who is the Director of Paediatric Gastroenterology and Hepatology at the Institute of Digestive and Hepatobiliary Sciences at Medanta, the Medicity. We also have with us Dr. Pawan Rawal, who is the Head of Gastroenterology at Artemis Hospital, and Dr. Somashekar Rao, who is the Consultant Gastroenterologist and Hepatologist at the Department of Medical Gastroenterology and Hepatology at Apollo Health Clinic. A very warm welcome to all three of you, and many thanks for joining us today. So, Dr. Neelam, I would like to start, the discussion, with you first. And I just I mentioned about, how hepatitis, is emerging as, one of the, global priority areas in the health policy making. And in fact, it is accorded the status of, a big public health challenge. And in fact, at the policy response level, if we see, India was in fact, the first country that, in the Southeast Asian region that developed its own action plan. So now, these are all, responses at the policy level, but in a very simplistic language, if you could just, help everybody, the basic, people at a common level understand that, what exactly it is about hepatitis that makes it, such a huge global health issue, in the first place. Over to you, ma'am.
Yeah, thank you very much for that opportunity. And as you can see, the very fact that you have come over to talk about on this Hepatitis Day, what does it really mean? It means that all those people in the last a decade have been working to increase the awareness could go ahead and hitting onto you. So it's the typical chain that you need to do. First of all, to understand any problem is awareness. And the basic fact that was a major problem in our country, the main, I would say, like in my fingers, if I have to say what were the 5 challenges that we were facing in globally and, Asia and India, is one, there was very poor awareness about it among public. Like maybe, you talk to people, what is hepatitis, they wouldn't know. So everybody knows what is HIV. And imagine HIV came, the virus was diagnosed much, much later than an hepatitis B and C virus. But people knew about, so it was the awareness with which among public. Second, even the awareness among doctors. You'll be surprised that to some extent, even the doctors generally, I mean, I'm talking of the general physicians, forget the experts, did not know much about this disease. So that was another issue that we were facing. Along with it, when we want to do the blood testing, these tests were not very easily accessible, especially for hepatitis C and all. So these were the challenges and the stigma. People thought if I have hepatitis B, I remember very clearly, 15 years back when I used to practice and I would identify in a child and I would want to do it in the mother or adolescents, I would take. They didn't want to inform to their partner before marriage or tell. So there was such a big concern that, that they will not be accepted by the society, their in-laws and children. And so all that stigma that was there in the public, and of course, final thing is the out of cost expenditure. So these, I would say, as the major 5 things, we were as a major burden in our issue where we were not. But over the years, I can say that the awareness has increased. There have been quite a few liver experts who have been working, round the clock, day in and day night, to talk about it. And I'm privileged to be the president of Commonwealth countries of pediatric gastro, which is a very big responsibility. I mean, I'm talking about whether it's Sri Lanka, Nepal, Pakistan, London, some of these states in Africa. And also in that we realized, so in the world, when we were trying to think about a theme, what theme we should go to talk about of the health of children, can you believe it? The first thing that came about was hepatitis. So I was fortunate to be the first one to be selected for the last decade. I can say that I've been the first author and the head for the countries, and the World Congress is held every 4 years, where we thought it is important to globally achieve it, not necessarily because loads and loads of people who in adults are dying. So if I talk to my friend, I pick up my phone and say, Ravi, what is the percentage of liver transplants you're doing in adults for hepatitis B and C? Can you guess, a vague guess, if I've said that we have done more than 3,500 transplants, can you guess how many would have been for hepatitis B and C? Wide guess.
Any
Guess it.
Anything less than like 15-20% or
80%.
So what I'm trying to say is that when we talk about liver transplants in adults, they've been talking about 30% to 35% of the total transplants is viral hepatitis B and C, which is huge. 1 in 3 persons who are getting a transplant is because, and if you talk about people who are cirrhotic in adults and who have liver cancer, so they're all struggling. I was just giving you an idea about transplants. So the load of all this, why is it happening? They acquire it when they belong to me. I'm like a pediatric up to 18 years. So they were not being identified in the early childhood, adolescent, and they kept carrying that virus for long because they were not very symptomatic, and then they ended up with cirrhosis, cancer, transplant, and poor them. They were just 40s when, they had to see this. So that, besides that viral hepatitis, now the term hepatitis continues, which is the fatty liver disease or the NASH, which adults in urban cities in India, we are calling it 25%. Rural, we don't have much evidence except some West Bengal data. They've given 10%, 9%. So we are seeing a lot of all this. And if I had asked you or anybody in your family, do you know what causes the 1 in 3 people who are walking on the road have a bad liver? And they wouldn't know it's due to a fatty liver. So the second 1 in 3 is got hepatitis B and C. No one knows. So it's time that we realize that awareness is the first step. I'm so impressed with the way we fought COVID. Wasn't it the awareness that media brought? You ask anybody, now they know what is COVID and all. I mean, generally the awareness went on to a lot. So we probably can, use the shoulders of COVID and educate on the vaccination for hepatitis B. Sadly, it is so cheap, but yet people don't take in adults. Of course, the government is now giving free for the newborns. The reason you want to give them free is when they go subsequently into adulthood. So that population is affected. I mean, if we had money, we would have been able to vaccinate the whole country. But we started with this. But if you really want to do some charity, maybe you should do some vaccination camps for hepatitis B. We don't have vaccines for C, and hepatitis A in children especially sadly gives rise to liver failure. And again, 8 to 10% of the total liver failures, total liver transplant in children are due to hepatitis A, which is preventable again, either with a vaccine or safe water, drinking water, hygiene, food, etc. And B, we know, prevents by sex, contaminated needles, blood products, mother to child. So if we are able to tell this, that you're going for a haircut, did you ever check that razor what you put around your neck? Was it used on a hepatitis B? You don't know. You go and do beautiful manicure. Did you ever bother to ask that person to use the filer in Sidex before using onto you? Thanks to COVID, now you will sanitize and use it. So these were the mistakes where people were making when they went to the, the men or the women, the nail cutting, the parlors, the filers, and that's how it kept spreading without people, knowing about it. And they say that the blood drop that you need to spread hepatitis B is much less, 1 in 10. Pawan would correct me, 10 times less or 100 times less than what you can get HIV. So even a small drop of blood, even if it is dried, it can have the virus close to a week, and in that week can spread. So I go around to schools and educate them that kabhi agar, somebody playground mein kisi ko khoon aa raha hai, just don't run and jump and haath se daba do. I teach them to use a napkin, a hanky, and use it if not a glove, because you never know who's got it. That's what. Having said that, we've improved a lot. The population is now 2 to 3% is hepatitis B and 1% C. So that means 3% of the children can have, and you can accidentally touch their blood and, all about. And for adolescents, you'll be amazed that 17, 16 years, they have that desire to have sex. And if they don't have their girlfriends, I have had 4 children who, they, good family, but they actually ended up, you see movies also, they end up with somebody, on a paid basis because they want to try themselves out. And they don't realize that how important was for them to use condom, and they thought that it was not fun without it. And so these were the small little things that we all need to bring about awareness in our masses about the Save Water, Swachh Bharat Abhiyan, what Modi ji says, the toilets which he's introduced. These are all efforts to reduce hepatitis A, and the vaccination camps and awareness and safe sex and blood products. These are all what we need to look. And 2018 is when I think the national, July 20, 2018, they formed that national preventable, what is it called? The National Viral Hepatitis Control Program. So that was a very good effort made by the country. And we are marching, but there's miles to go. And I was always also privileged to be as the IMA head of hepatitis B and C 5-6 years back, because I used to do a lot of work in Hep B and C through my society.
Right. Thank you, Dr. Mohan. And I think you have, given a really good landscape, because any common man person who would be listening to this conversation, this is not very technical. And the way you explained it, I just hope many people listen to this message, and the message, gets across to, the larger audience, the better. Thank you so much. And just
I would only say one more thing, that those who are admirers of Salman Khan, he said, if I do good to you, ek movie mein bola, he said that you do good to 3 and that 3 does good to 3 and the chain goes on. The movie, I don't remember, but that was a beautiful thing what Salman says, and I think that's what we need to do. If you've learned something today, make it a point that you teach some more around you and tell them what it is about hepatitis. Those 3% also we want to get rid of by using the vaccines. And
right. Thank you so much, ma'am, because I think it is very critical for people like us to spread this message in as simplistic manner as possible, because yes, technically everybody speaks, your policy speaks a very technical language, but till the time it is not communicated at the kind of it's not articulated it in a common man's language. I think that's where that's the key, that's the biggest barrier. Secondly, I think you talked about school education programs, in fact, that you are an integral part of. And I think maybe in the due course of time, we would like to hear more from you on that, because I think the conversation that we are having, in the last panel as well, was essentially about creating, socio-cultural practices and, is really institutionalizing, these practices from the beginning itself. And I think that's one of the key there. And lastly, the vaccination, because COVID has literally sort of brought to the fore, everybody now knows what vaccination is. And, of course, there is some component of vaccine hesitancy. However, largely we do understand, vaccination in a very different light. And I think maybe we could learn and co-learn lessons and adopt on the hepatitis conversation itself. And I think towards, maybe at certain part of the conversation today, we would be moving towards that. But I would like to bring in your Dr. Pavan and Dr. Somashekar now here. And, if you could again, briefly reflect, I'm just throwing the same question at both of you, that, what according to you is that, what really makes this a challenge in your opinion? And, what are the key barriers that, we are facing, at a very primary level right now? Dr. Pavan, over to you first.
Yeah, thank you for inviting me, Dr. Nalini. It's a very excellent question. I mean, why we are talking about hepatitis B and why we are celebrating World Hepatitis Day, and this is pertinent. I mean, as Dr. Neelam also said, it's because of two reasons. One, because the burden. We being a developing country, we are facing a lot of burden from hepatitis B and its consequences. We know everybody who has hepatitis B and C doesn't develop cirrhosis or complication, but at least 20-25% would have it. Once we talk of the barriers and issues related to hepatitis B and C, the most problematic issue is the diagnosis. The problem is hepatitis B and C is not like COVID. I mean, they don't have incubation period of 5 days and they don't develop symptoms over 5 days and then they don't go off. Actually, the incubation period is long. They stay in body for years before they got any damage to the liver, and the symptoms are extremely rare. I mean, there are millions of people staying in India having hepatitis and they are not knowing about these because there are no symptoms. Added to it is the reserve of the liver. Liver is a very reserved organ. I mean, till the time it's damaged to the tune of around 80% or so, there will not be any symptoms. So these two things, that is the longevity, and the virus staying in the body for long before causing any symptoms, and the total reserve of the liver, which is huge, the person would have hepatitis B and won't be knowing about it. Now it's very, deadly combination. Now suppose there is a society having 2 to 3% prevalence of hepatitis B and nobody knowing about it. That means they are harboring infection. They are potential people who can transmit it, but we don't know, physician don't know, and they themselves don't know. Now, barrier to me, it seems, same way. The diagnosis and people knowing about them that they are suffering from hepatitis B is the biggest barrier. Now, how to tackle them again would be an issue. One, of course, vaccination, as we have included it in UIP, and now new neonates and newborns are given hepatitis B vaccination. But then there will be a pending burden of millions of people who were born before that and who are not vaccinated, who again provide a good reservoir for the transmission. So right now, other than vaccination and yes, opting for the preventive modes of transmission like the contaminated blood and contaminated needle, the sexual practices, safe sexual practices as Dr. Neelam talked about, and of course the other measures, I think early case finding at this point of time becomes a very, very important point if you want to eradicate hepatitis by 2020. So yes, summarizing, I would say that early diagnosis and the diagnosis is an issue which probably will be hindering the eradication.
Right. Thank you, sir. And thank you, Dr. Pavan. And I think I do have a follow-up question that, yes, we do know that, early diagnosis is really important. And what do people should do? Like, maybe many people who would be watching this conversation, they don't know. And what should they be doing that, because as you just told that it manifests at a very later stage where, a large chunk of damage has already been done. And I think it's really important for us to now bring to light the kind of awareness that the basic awareness that people should largely have. But before we, I put that question, on the table today. I think I would want to, hear from Dr. Somashekar first that, so if you could also add into the conversation that, what is, the larger challenge that we have?
I would like to add with Dr. Pavan, actually, lack of awareness about these viruses is the main barrier at this point of time. And we identify, as a gastroenterologist or a hepatologist, we identify these patients once their livers are damaged, once they present to us with symptoms of cirrhosis or liver cancer. So these people, only we come into contact only with these people and their family members. And most of the time we try to educate them, and at least the family members are screened. But if the same thing, this education spreads into the masses, into the general public, and encourage voluntary testing for everyone, especially in childbearing age, women all childbearing age, if they are tested for hepatitis B and hepatitis C, and just with awareness and voluntary testing, we may be able to identify a lot of people who are, as Dr. Pavan said, they are carrying these viruses, but they themselves don't know that they have these viruses.
Right.
So this is most important, as I feel. And availability of the tests, so definitely hepatitis B, HBsAg and anti-HCV for hepatitis C, they are available everywhere, every nook and corner in our country, and basic screening tests. So everyone are accessible to the diagnostic test. Only thing is awareness. Educate the people, this is going to affect your liver, and these viruses are curable, and they will start testing themselves voluntarily. So like, see, now in the last 1.5 years, everyone is aware of COVID, and they are testing themselves in spite of, even if they don't have symptoms, they are worried. And people are not worried about hepatitis because they don't know anything about these viruses. They don't know how it is damaging. And people who are infected, who knows they have hepatitis, they don't want to talk about it. It's a taboo. There's everyone, they want to keep that as a secret. They don't want to talk about these viruses so that many people will know. So as a group, people who are treating, seeing patients and seeing these complications, maybe we should be increasing the awareness, just talking about these viruses, and encouraging voluntary testing I think is the best thing to do at this point of time.
Absolutely. And I think that's exactly, what I wanted to now direct the conversation to, that yes, we have understood that, yes, more often than not, the whole, if somebody is infected, it stays dormant. It doesn't manifest, until a larger damage is done. But I think here another problem is that, hepatitis it's not one, it has many other variants. We have different types, A, B, C, and D. And I think many of us who do understand hepatitis, we don't understand that, there are different types. And also, maybe certain type could be, prevented through basic preventive measures or through, early vaccination, and, in which all cases early diagnosis is very critical. So I think that level of awareness sort of, we need to initiate, as part of our larger awareness programs. But what is the way, like, maybe, yes, we are having this conversation, but what are those concrete steps where, we sort of, bridge the gap of diagnostic literacy, first of all, or maybe just the basic literacy among, the masses about the relevance of, diagnosis in this particular space. And I think, again, I would, come to Dr. Neelam, if you could just reflect on that, illiteracy, diagnostic illiteracy, in fact, is a big common theme that we have in this particular space. And yes, you did mention about the school programs that you do. So what are apart from that, and also we would like to hear more on that as well. What are the ways out for us, if we need to just narrow down to the conversation of awareness? Ma'am, you're on mute. Sorry. Yeah.
Yeah, I was just trying to note down the points while they were talking, and I thought that if you ask me what are the 3-4 ways, what is in me. So first, I think is education and awareness. And second, I think is screening. Third, I think is vaccination, and I'll talk about each. So what do I mean by education and awareness? That is, we are trying, and that this disease is very common. It is seen 3% of our entire, imagine if we have 136 crore population, 3%, imagine the burden calculated, are with hepatitis B and C. Today, I'm focusing on hepatitis B and C, and I will not talk about fatty liver disease and fatty liver hepatitis or alcohol hepatitis. Let us keep that a little aside and talk of this burden first. So for this, we need to get this awareness, what you're saying, and screen whom. So one Dr. Somashekar was saying that screen everybody. But to start with it, what we do is we screen all pregnant women. So now it is a routine in our country, rural, urban, we are screening. We screen all patients before they go for any procedure, surgery, operation, anything. So that is the screening that they are going. Blood transfusion, obviously, when you're giving I'll talk about next. So screening. And third, I want to say, don't ignore symptoms like thakan, fatigue, malaise, loss of appetite, loss of weight, something like non-specific symptoms. If you have, please screen for hepatitis 2. So that also I want to say that think about it. And then vaccination, of course, besides all newborns, try as much as possible to vaccinate people around, because as I said, holding camps and all this are going to be very, very good. Now, last, I will come back to the awareness part. What do I want you to be aware of? What? So I will tell you some do's and don'ts. So what do you do? I would say that like people tattooing, youngsters. So please be aware. You might be excited about tattoo, but I really don't know who went. Till today, I haven't got a tattoo on me, though I love getting a tattoo, but I get so scared, like, eating pani puri on the road. Accordingly, I think about tattoo. So tattoo is something which you've got to be your dental, where you're going, what needle is he using, what injection are you using, where are you going and getting a blood transfusion done, where are you getting your nail file, where are you getting your razor shape, all. So even educated people don't know. They say, aaj main bahar ja raha hun shave karane. And they just, so this is what I want them to educate: body piercing, nose, in, belly button, ears, everything. So these all carry a risk. And children or anybody, when you clean somebody's wound, don't be too heroic. Either use a glove or a hanky, because you don't know. And for young girls and women, I would say, don't throw sanitary pads in dustbin. It should be properly put in a wrap packet and sent, because God forbid, those people who are cleaning, and so it is contamination. So how they should be disposed, we need to talk to people about it. We need to talk to our children and everybody about safe sex. It used to be once upon a time when we were children, we were told truck drivers mein hota hai, if you recollect. I think it's no more like that, because people used to think that they move from here and there and they have. But it is so rampant for people to have sex around, and we should not shy away in our country, in India. Sex is a taboo. People don't like to use the word sex at all. We need to discuss it. We need to talk about safe sex to our adolescents, to children. Parents should talk about it. Why should you feel shy? Just like you talk to a girl about periods, talk to them about safe sex and what problems, because nobody will think कि मेरी friend को हो सकता है. How can you think that मेरी classmate को होगा? So as I said, in a classroom, if they were 100 children. I said 3 of them had it. So how do you know who's that? 50 में से एक बच्चे को था. So think like that. And these are just little tips I thought would be very useful for the public. And the more and more we talk about awareness, about hepatitis, about getting the blood test for even non-specific thing, thakan ho rahi, ye ho rahi, do a blood test. You never thought about it, do it. I to sometimes say when you have liver disease, you even start getting darker. At least in children, I see cholestatic, so I see. So I keep telling parents all these things that take the steps whenever you feel anything, do test for your liver. So I want to say test for your virus, B and C. It is not very expensive, but not routinely done. Not routinely. If you go to a lab and see how many had B and C, you will hardly find. It is only in hospitals, those who undergo surgeries, they as a routine, surgeons don't touch before you do BC HIV. So they are the ones who are actually helping. Or when they go to give blood transfusion, on transfusion they are told, "Aapka nahi le sakte khoon, aapko bhi hai." Then the person realizes, "Oh my God, I have." So that's what, and then they don't want to tell either the husband or the wife, and they have unsafe sex because they know, but they think ki nahi bolna. That is totally wrong. If you know about it, please share it, because all that you need to do is give vaccine to your spouse and you can prevent it. So don't shy away and don't say ki nahi bataunga.
Right. Thank you, Dr. Mohan. And I think if I just sort of sum up, the points that you've mentioned, as a viewer, these are very basic points. However, when as a policymaker, I think of it and I think that, how do we operationalize these, even the most basic parts that you just talked about, I think that's where I feel the biggest challenge lies, because no matter the number of policies we have, this require, if a patient is going to a healthcare practitioner and says that, I have fatigue and malaise, and how much of, in response are we sort of, being told that, okay, let us...
That's why if you remember my first statement, I said 5. I hope you remember my 5.
Right.
First, I was awareness among public. Second was awareness
among the HCPs themselves.
Doctors.
Yes.
So the last was ease of, the availability of testing and, the cost implications, etc. But even awareness among doctors, that needs...
Right, absolutely. And I completely, hands down, I completely agree with you. And I think it's really for all of us to toss our brains on the fact that, yes, that's, again, our linking point here. But then how do... maybe, we are all part of the same ecosystem. How do we sort of now operationalize, those sort of, very small action points? Again, you talked about, today's generation moving towards tattooing and, many other things where the usage of needles, be it in the salons and, be it any other lifestyle areas that we are looking, that are proliferating these days, anywhere, whereas, the use of needles is rampant. I think that literacy needs to be there, not only amongst the masses, but the people who are using those, all those, tools, etc. But I think, and in fact,
to say drugs, I think I forgot to use the word drugs.
Yeah,
that's also very important.
Yes, and in fact, wherever we have these, at least the salons and the lifestyle sector is really evolved in India. We do have those collective groups. So maybe at a certain level, maybe we never thought that, my hairstylist should be aware of this thing.Maybe we can start building a knowledge amongst them, because it is a really structured sector now. It's an organized sector.
I was one of the first ones that I connected to VLCC, and they're so grateful to me. Almost more than 1.5 decades back, and I insisted them that they must learn to put all the filers and everything, and even they now put combs. And at least I go to South Delhi, and they haven't changed now, because I feel that is how, wherever you are, start working, start giving knowledge, start sharing. You don't have to get the knowledge from a doctor. It could be anybody who has a knowledge can share about things and talk about. So this is the important. The owner's lies not on you or me, it lies on we. The day we understand the difference between M and W, we'll achieve. I guess Nalini is not audible. Somashekar, can you hear me?
I can hear you, madam.
Probably her connection is there. So Somashekar, I wanted to know, what is the situation in Hyderabad? What is the prevalence in Hyderabad that you see?
Actually, I have been doing a lot of screening camps in and around Hyderabad, all over Andhra Pradesh and Telangana, madam. So in few areas, actually, few districts, if I say, hepatitis C was prevalent to a range of 7 to 10% in few areas, actually. So we have been informing the government. Now recently this national viral hepatitis control program has come into place.
2018.
Yeah, but still the drugs are not available free of cost. I'm talking about when it is free of cost, because many of them can't afford hepatitis C treatment as hepatitis B, actually. So one time it is like somewhere around 15 to 20,000, even if they get it on a reasonable price. So many of them are backing off.
There are a lot of states which give free treatment.
Yeah, even in Hyderabad and
I thought was a state which is free, if I'm not mistaken.
At this point of time, we are not getting adequate amount of medications for hepatitis C, madam. Maybe we'll
Nalini, sorry, you will also. I took your role. I just wanted to tell you that Punjab is the worst hit in the country, and the reason was drugs.
Yeah.
So you saw that movie. I'm bad in remembering names.
Urta Punjab.
Urta Punjab. Thank you very much, Rob. So that is where they were talking about how everybody was into drugs. That's why Urta Punjab, and now everything is free in Punjab. They got free screening, free treatment, because the government realized the burden is a lot. And as he says, the state governments have to come forward and take it. Sorry, and over to Nalini. She's back.
No, absolutely. Really appreciate Dr. Neelam for filling in, because we are facing these technological issues because of bad weather. I really appreciate that. And I think I will just continue again with Dr. Somashekar, because, you were just speaking about it. And I think the same conversation that if we need to, build awareness, we have this predominant theme that, okay, general masses needs to be sort of, made aware of. However, I think we need to, do that more gradually. Let's also educate doctors. Let's also educate many other professional groups where, these practices could, manifest into an infection. And I think that all these practices or maybe these smaller steps might have a spillover, right? So what are your views on that? And, maybe if you could also discuss largely that, barriers, overall barriers on the diagnostic front.
Yeah, I actually completely agree with Dr. Neelam Mohan. Whatever she said, absolutely. It is not just awareness in the masses, in the public. It's a lack of awareness in the doctors, healthcare workers. So yes, we need to build that. And as you were mentioning, some special groups where who can influence people who are, at this point of time, for example, when you're talking about saloons, which are well organized at this point of time, educating them. This is definitely going to help in a wider thing. But when we are talking about rural population, definitely, their healthcare workers needs to be educated very well. And directly into the masses. We have been doing large screening camps retrospectively, wherever if I see a patient in a tertiary care center with hepatitis B and hepatitis C, we retrospectively went back to their native place, to their village, to find out maybe there were some places where they acquired these infections. Retrospectively, when we went back, we have seen large cohorts of groups who are infected. Actually, in few areas, if I say at least 7 to 10% had hepatitis C, at least 12% had hepatitis B in few areas in Andhra Pradesh and Telangana, actually. So where we retrospectively screened everyone, we actually educated the people there, screened everyone, and we have seen lot of positive patients there. So this may help retrospectively. In some places we can go back and talk to them and get screening tests done and priority basis. So we can't screen everybody. 140 crores we definitely can't screen, but we can make a priority whom to screen, where to go back and screen everyone, educate them, and that's maybe it's going to help. And one more thing what I was talking is availability of medications through this national viral hepatitis control program. It was freely given in Punjab. It was a successful program, but not all states have received the drugs, and because of this COVID in between 1.5 years, the activity, that program activity has come down a little bit. Maybe there are a lot of cases in Telangana and Andhra Pradesh, around Hyderabad also.
Right.
Where the treatment have not yet started from the control viral hepatitis control program.
Right.
So we need to initiate those things also.
Right. Thank you, Dr. Ravi. And I think Dr. Neelam and you, both of you have mentioned, in certain areas about, the national.
I guess Pawan can give his views on Haryana. Ask him.
Absolutely, absolutely. I'm just coming to that, if I connect the same conversation to the hepatitis control program that we have by the Government of India, it also actually recognizes this point under the management protocols and, other aspects and the data. Now, you talked about, data at the state level, maybe at Haryana, and, because, yes, we do have inpatients and we see those, but you all three of you are at that interface where you have, the privilege of maybe gathering more data. In the retrospect, you can connect the dots and you might know that, which areas are more prevalent. So maybe that could be the strategy. So Dr. Pawan, do you have certain, data points and any findings to share, as a practitioner on that front?
My mail is on.
Yeah, so I agree with Dr. Someshekar, and just add to few points to screening. I mean, till the time we are in a situation to screen everybody in India, I'll add few things. I mean, let's focus on the high risk population. As a clinician, I mean, people like undergoing dialysis, people who are immunocompromised, people who are HIV positive, people are receiving steroids, people are receiving chemotherapies. I mean, these are the people who are actually at high risk of getting hepatitis B and C, especially the C. So not even hepatologists or gastroenterologists, everybody, including physician, nephrologists who are taking care of dialysis units, the oncologists who are treating the people who are immunocompromised, where the flare of hepatitis B is so common. So let's at least put the priority area in before we are able to implicate, or maybe we are able to screen whole of the population in India. This is fine. Now, second point, as already put, yeah, I mean, the cost is always an issue in the set of the population we deal. And rightly said, the Punjab was the leader. Now, Haryana also, I mean, for maybe last couple of years or more, it started with the PGI Rohtak. I mean, PGI Rohtak is a medical college, the first medical college in India, in Haryana. So the treatment was provided free of cost. And there are provision, at least for hepatitis C, I'm talking about, not about B. So yes, the increasing number of areas, even in the district hospitals, are being provided the medication for the hepatitis C. Why? Because hepatitis C now at point is very easy to be treated. Gone are those days when we will remember ever as postgraduates, where it was the toughest of the hepatitis to be treated with, treatment having lakhs and lakhs of rupees to be poured in, and a lot of side effects before the medicines. Now hepatitis C is very easy to be treated, single pill, at most 3 to 6 months maximum, and the only issue was the cost. The cost has been brought down because there has been a lot of competition in the market. But yes, I still agree that more and more of states should be covered where the treatment can be provided free of cost. I mean, at least based on the poverty data, or maybe based on the income data, or some criteria can be set in where the treatment can be provided free of cost. So that will add to the the eradication.
Right. So in fact, so I just hear that Dr. Neelam might have to excuse herself, but ma'am, thank you so much. It was, a very insightful discussion with you, and I think we hope to connect with you again because, ma'am, you're on mute, sorry.
There was so much to learn from you all. I'm so happy and impressed with you, Nalini. That was really very sweet of you to have taken out time on this auspicious day for us, for everything. And so nice to see Someshekar doing good work. I was the one who started with it, with this society child, and it was a difficult struggle. But I'm so proud all of you are doing. And I would like to apologize. I wanted to give a talk to Rotary and Lion Club as much as I can. So I have a talk with Mumbai Rotary.
Right. No, thank you very much.
Nice talking to you, madam. Nice
Absolutely, and I think we shouldn't end here. I think maybe you have to leave today, but then I think the conversation should, it has started today, and it should just move towards, more tangible outcomes because today we are just scratching the surface of, the problem areas, but till the time we don't bring the convergence of all the kind of skills we all bring to the table and translate into really, certain outcomes, I think this conversation would really not, be of that significance otherwise. And I think I thank you, and I think we would collaborate and we would connect with you soon to, maybe to see how this conversation.
Thank you so much for those words, 10 out of 10.
Thank you so
for
much.
that convergence. Thank you.
Thank you, Dr. Neelam. So yeah, coming back to Dr. Pawan and Dr. Rao, to you, that, now, yes, we know that we have a national virus hepatitis control program, which is a very, what would I say? I mean, a very, I think India has taken a lead. And if I at least look at the policy document, it is very ambitious, very, forward-looking as well. However, I mean, how do we, when we look at the implementation and how is it really, getting translated at the ground level? Of course, it's been just like 1 or 2 years that the program has just, started, but, the real outcome would take some time to, be shown, at least at the quantifiable level. But if I specifically talk about, the standardized treatment and the testing protocols which it mentions, so it talks about access to diagnostic services and access to treatment and, wherever vaccination and somewhere, the medicines and other things are possible. But then how do you, on papers, policy papers, these things are there, they look good. But as practitioners, when we really see that, what is really happening on ground, then there's a gap. And, instead of criticizing, that we do have a provision, how do you think we can just, help, translate these goals better at our own individual level?
I would say actually for a whole state, for example, there is one nodal center and a nodal officer. I don't think that is adequate enough, because it's a lot of pressure on one single person. So this should be at the district level, it should be well organized. I mean, on the paper, it is definitely there, but it has not come into action at the district level, at least. Till now, at this point of time, I think at least I can say only about Telangana and Andhra Pradesh. There at state level, definitely there are nodal officers and 2 centers actually. But they can't cater whole state at this point of time. At least only once we have district level nodal officers and district level centers, yes, maybe that's going to help. And already with existing data available, there are few areas where there is high prevalence, and in those areas, if there is a lot of work to be done in those areas, if at all necessary in the district, to a lower level, at a mandal level, if a nodal office can be established. Right. And there should be maybe some person who is taking care of, obviously the state nodal officer will be taking care, and he should not be, at this point of time, a gastroenterologist or a hepatologist who is practicing, who is a professor, is appointed as in charge. So they will be busy in other works. The person should be exclusively allotted for hepatitis control program, as we have in any other HIV control programs, HIV, these things. We need someone exclusively for hepatitis, because when we are committed, at least on paper, definitely to come onto the ground level, we need more people working on this. In that way, we will be able to educate more people and bring awareness in more people. So if the number of people who are working on this are increased, at least in places where there are high prevalence, if there are more number of people working on this, definitely according to the, all other things, I don't think as a gastroenterologist and hepatologist, things are all how to diagnose, how to treat, everything is very good on paper. Only thing is implementing these things needs more manpower at this point of time. And just central government, I don't think it is easy for the central government to monitor whole of the country. States should pitch in and come forward to add. See, universal immunization program is going on very well all over the country with the partnership of central and state governments' health policies. Same thing should be added on to every state government's policy, and they should make it as take it as a priority. Then definitely these things, not just on paper, they will be on the ground also. Definitely things will be better.
Absolutely, I completely agree with you. And Dr. Pavan, on the same point that, early screening, early diagnosis, vaccination, these are certain points. But I think, and also correct me if I'm wrong, that more often than not, the policies talk about, vaccination amongst the healthcare workers and, the high risk population, as we put it. Now, yes, that is really important. But, very briefly towards, in the middle of the conversation, we talked about, certain population sets, which anyways, when you as a practitioner, you have the data and you locate back, you see that, the whole village and, a huge chunk of the population, they are infected. Now, they are also categorized as, the high risk groups. And at a certain level, we do have that data. However, the data is so scattered that, we maybe, do you think that we are failing to consider them also as the high risk groups? Because and then that's why we talk about finding the missing cases, and that became like the huge global agenda that finding the millions, which was a hepatitis related campaign, because millions of cases were even today are just missing, and perhaps they are missing because we are just not connecting the dots that we have, because we have scattered data. Even if I look particularly at the India level, we do have a lot of data, we are just not connecting the dots. And, we are just missing out on the cases. But then now whose duty is it to connect those dots? And, how do you think that, we can find our missing millions, if not globally, but at least nationally?
No, great. I mean, this is excellent. Let's talk of a country of 140 crore people, and the government starting a program to control or eradicate hepatitis, where the prevalence was 2 to 3% for B and 1% for C. Let's be very practical. The practicality is that this is a virus which is not like COVID. This is not overt.
Yes,
Now, finding the hidden cases, treating them, and preventing. This is a huge task.
Yeah.
So, we need to prioritize, that's for sure. You cannot cover 140 crore people together.
Absolutely.
As one of the very important point, Dr. Dr. Rao also said, whenever somebody sees a patient of hepatitis B and C as a doctor, it should be informed. Either he or somebody out of the government has a duty to pick that pocket around that patient's epidemiological area or habitat to see the prevalence. When somebody is coming to you in the OPD, I mean, clinicians have a role. We may not be an epidemiologist to prevent it. So let's see. I mean, as Dr. Rao said, you find a case in your OPD that the X and Y is positive for hepatitis B and C. Let's go to the demographics and let's find out the pockets first.
Yes.
So before we eradicate it in a population of those many Indians, let's find out high-risk population, as we talked about the groups. Let's find out the pockets on the basis of epidemiological data available by the evidence studies. There are studies which are epidemiological study, and we have high prevalence. As Dr. Rao said, the areas of Punjab, adjoining area of Haryana, or some area of Telangana, Andhra Pradesh, where he found that the incidence was so high, prevalence was so high. And last, what I said is, it's our duty to pick the pockets, even the small pockets, because these people, suppose, are coming from X village, and I find that I have a patient of hepatitis B and C. I can inform that probably this guy has come from this village, and organize the camps in those areas to pick up people early, or focusing the vaccination on this group as a priority actually becomes good. So that's way we can actually decrease the bigger reservoirs. They are in any case spreading the virus. But if you pick the bigger pockets or heavier pockets or dense pockets where the hepatitis is so prevalent, I mean, this should be the first priority before we be very practical about actually eradicating the virus all over the country. Of course, later on you can, classify or you can triage this area as the high risk, intermediate risk, and low risk, and this is the way we go in. Yes, it's a difficult thing. I mean, because of the type of virus we are dealing with.
Yeah.
But then probably this policy may help us. And finally, the decreasing the cost and easy availability of the drugs to everybody. Let's talk of the compliance. The virus, which is not very, very lethal at this point of time, at least not acutely, the people will not spend that 20,000 rupees. Believe me, it's very difficult. 20 or 30, whatever it costs. So making it accessible to a common person is also equally important on the government side.
Absolutely. And I think I completely agree with all your points. And I think one, like you said, that, we sort of maybe need to integrate like at the epidemiology epidemiological level and many other levels, that's the way to go. And I think COVID has really taught us that, yes, it's not only about infections and, how, even the vaccination program that we saw during COVID, that yes, we did have all the medical help, but then till the time it is not a convergence, people's literacy around the subject, really gets affected, and which really impacts the success rates, if anything. And I think same lessons need to be incorporated and learned for hepatitis as well. And, and I think another thing is the access to treatment, where absolutely very correctly said that, a problem which was as lethal as COVID because of the incidence and, the number, the way mortality mortality was associated to it. I think we took it extremely seriously, impacted the whole world. It brought the whole world to a standstill. But let us, not stop the learnings only to COVID and not restrict it, and rather learn more, because I think it is for, if we need to expand the access, it has to, spill over to many other, other disease categories as well. So
I'll just interrupt over here for a second. As COVID also taught us how faster we can be in getting the newer medicine and newer vaccines.
Absolutely.
Believe me, I was never aware of that. Yes, the permissions can be given so fast, and the drugs can come so fast, the vaccines can come so fast in the in a general population. So this is probably has actually unearthed the other area of medical field, the speed with which the things can come up and be implemented, of course.
Absolutely, and I think on that front, I would just like to say that yes, it was a huge regulatory, challenge, but then nothing, I think, is set in stone. The moment we prioritize any health issues as a global health issue, I think all rules and regulation can always be amended to the extent, only to fulfill the point that it's really fulfilling the, the last mile approach that we really want in the healthcare, right? So I think if we sort of bring now the awareness on all of those different levels, because it's a problem of the entire spectrum, rather than, restricting the conversation only to awareness and, vaccination and diagnosis. So with this, we do come to, to the closure of our today's session. But, firstly, I would like to thank both of you, and also, Dr. Neelam, Mohan, for reflecting on so many challenges that we have, because I know 1 hour is not because of the complexity of the issue. However, at least at a broad level, today we were able to, at least highlight the key challenges. And I think the way very simplistically we have really dissected the problems, I'm sure everybody who would be watching this particular discussion would, be slightly aware of, how to be a conscious, how to adopt conscious methods and practices, in their own normal behaviors around it. And, with this, we just take the, opportunity to just propagate the message of, be safe and, be aware and be, practice, any kind of, things we adopt, be a conscious practitioner of your choices. And get yourself vaccinated, be more aware about hepatitis. So thank you so much, and on behalf of IHW Council, I would like to thank all of you and to all our participants today. Thank you so much.
Thank you, Dr.
Thank you.